Hi, I'm Stuart from Core Elements Training, and today's video we're going to be demonstrating C-spine traction and C-spine passive physiological side flexion of the vertebrae. So with C-spine traction, if we want to hit the lower parts of the vertebrae, so C4, C5, C6 and C7, we're going to angle your client's neck up to a 30-degree angle, so you need quite a low bed. So therapist takes a nice squat position, okay, so the back remains straight, okay. You're going to use your left hand to cut the base of the skull, and you're going to use 2 fingers on the bottom of the chin, and you're going to do a test movement to make sure that your client is happy with the movement that you're going to produce, okay. So just lean into that squat. Is that okay for you? Lovely. If the client's happy with that, then you can hold this mobilisation between 30 to 120 seconds. I'm just going to do 30 seconds here, okay? And you can repeat the sets 3 to 6 times. Okay, so to recap, use your left hand to cradle underneath the skull, 2 fingers pistol grip on the chin, angle up to 30 degrees, nice low squat position, keeping your back nice and straight. The next mobilisation we're going to perform is physiological side flexion to the C-spine. You might want to perform this mobilisation if you have facet joint dysfunction on the left-hand side or neurological dysfunction on the left-hand side. You're going to ask the client to give you the weight of the head, and you're going to cradle the head and take all of the weight. And again, in a squat position, you're just going to mobilise through your grades over to the opposite side to the problem. So grade 1 and grade 2, just to help with pain in that area, okay? If there's no pain and it's just range of motion that's the issue, then you can move into grade 3, so you're in and out of range at grade 3. And then grade 4, you're end of range. Is that okay for you? Mm-hmm. So to recap, performing Maitland's mobilisations, distraction to the C-spine for either 30 to 120 seconds for 1 to 6 sets. You're using 2 fingers on the chin, angling up to 30 degrees and taking the entire weight of the head whilst in a nice squat position so you can maintain nice lumbar support, okay? And then just lean into the squat, making sure your client is happy with the movement for 30 to 60 seconds. So this will help all ranges of movement in the C-spine. So for lateral side flexion, you're taking the weight of the client's head, okay? To open up all the vertebrae and the facet joints on the left-hand side, you're going to move to the right, working through grades 1 and 2 if you're working to ease pain, into grade 3 and 4 if you're working against stiffness. So this was a demonstration of Maitland's mobilisations to the C-spine, C-spine distraction and passive physiological side flexion.